Now, with all of that said, I do want to introduce my wonderful colleagues who've joined me here today. We have Kirsten Connors, who is the Director of Student Financial Services and the University Bursar, and she can tell you what a bursar is. We also have Matthew Davis, who is Assistant Director of Financial Aid, who you may have met in some of the admissions webinars earlier this year when you were going through the admissions process. We have Erica LaRange, who is the Assistant Director of Student Health Insurance Operations, and that is also called SHIP. And we'll tell you about another webinar that Erica is doing tomorrow too, to get even more in detail on that. And then finally, we have Heather Gianillo, who is a registered nurse in our health services office. So we have lots of great wisdom here with us today, and I'm gonna get right into it and start with Kier Connors. Kier. Carrie, I think you might be muted. Okay.
I apologize. Let me try that again. Kier Connors, Director of Student Financial Services and University Bursar, which mainly just means that we are responsible for student account billing and collecting payments for your student accounts. Could we advance our slide? Thank you. So our team, we handle student account billing and payments. We process any credit balance refunds from the student account back to the family. We're responsible for loan processing and dispersing financial aid to the student account. And we also manage the internal installment payment plan, which is optional. So that's an option that parents and families can choose to use to spread out your payments. Can we advance? Thank you. So our next slide deals with billing information and deadlines. At Brown, all of our student account billing is handled electronically, so we don't generate any paper statements or send any letters regarding student account charges or credits. All of that information can be viewed through payment.brown.edu. In addition, we also on our website, we have a student account and e-bill schedule, which provides all of the deadlines for each semester. For this coming fall semester, our billing statements were generated yesterday and pushed out to students. And again, that's through payment.brown.edu. Our payment deadline is August 1st. So that's when the charges are due for the fall semester. And for families who choose to use the optional installment payment plan, the deadline to enroll for the IPP is August 2nd. Just one note on the billing statements that you will see online. So the billing statement is a snapshot in time, and it captures any charges or credits that have been posted at the time that the statement was generated. A question that we get fairly often is, something has happened after that statement was generated. Where do I see that? So in that same payment.brown platform, you would go to the account activities section, and that's where you'll see an up-to-date accounting of all of your charges and credits. And we can advance. Thank you. Payment options. So the most common method for families making payments is to make a payment online, ACH, so from a checking or savings account, through that payment.brown portal. Some families choose to use the optional installment payment plan, which allows you to spread out your fall charges over either 4 monthly payments or 5 monthly payments, depending on when you enroll. That IPP is done each semester. So if you do choose to use that, just know that you'll need to sign up both in the fall and in the spring. Flywire is used for international wire payments. So if you are, living overseas, if you do not have access to a US checking or savings account, we recommend Flywire as our preferred payment method. And what's nice about Flywire is it allows the family to track the status of that payment right from the time that you initiate it until it's received at Brown and posted. So that tracking has been very helpful. And finally, there is an option to send a check to our cashier office. And I've listed our website here if you need more detail on the different payment options that I just covered. And we can advance. Thank you. So I just wanted to talk a little bit about payment.brown.edu, which is our portal where students can go in and see everything to do with their student account. Students have access to that portal automatically, and they log in using their Brown credentials. If they would like to share that access with a family member, that student will have to go out and set you up as an authorized user. Students also use payment.brown.edu to set up their e-refund account. And what that does is it allows our team to process any credit balance refunds back to the student electronically. And that's much quicker and more secure than us issuing a check refund. On payment.brown.edu, students and anyone who they have created as an authorized user will be able to view student account charges and credits, make payments online, enroll in the IPP, receive important emails from our team. And it also, by being set up as an authorized user, it allows families to call in and talk with our team and get information about that student account. Can we advance? Thank you. One thing that I wanted to make sure that families understand is that at Brown, students are considered the central point of communication. So everything that our team sends out goes directly to the student. As you're having conversations, financial conversations with your students, you might want to encourage them to set you up as an authorized user on payment.brown so that you can access their information. Also encourage them to share with you an email that they would have received from our team yesterday for first-year students. So that walks through a lot of important financial information that's helpful as you get acclimated to being at Brown. We also have a page on our website which reiterates that same information. And please always just encourage your students to monitor their Brown email account. That's our primary method of communication. And you can go ahead and advance. Thank you. So I've listed here a few resources from our website. On our homepage, we have a quick links box, which takes you to lots of helpful information. Again, as I mentioned, we have our first year students page. We also have a guide, our e-bill and payment guide, that will help you with any technical questions when you get out and try to navigate payment.brown. And lastly, if you have any questions, please, anything related to your student account, IPP, refund, anything like that, reach out to our team at any time. Our email and our phone number are listed here. And with that, I'm going to go ahead and turn it over to Matt Davis in Financial Aid.
Thanks, Kier. And thanks, Mikkel, very much for also and everyone else on this as well. Greetings and hello. My name is Matt Davis, Office of Financial Aid, one of the assistant directors here. Some of you may have remembered me, as Mikkel had mentioned. We did some typical admissions presentation on financial aid. So I've chosen, I don't have slides only because pretty much what we're going to talk about has really been talked about already, but also on top of that too, it's kind of really simple. So what I'm going to do is I'm going to go over some things with you, and then I'm going to quickly just kind of go through some of the questions we have on here real fast. That were kind of pre-populated. So first of all, by now, families, if you were an early decision family or a regular decision family, you would have gotten your offer from us for the 24-25 year way back in December or in March, end of March. And for our current student families, we had sent those out last week. So everybody at this point in time right now, everyone should have an offer from our office and should know what their financial aid is for the upcoming year. If you did not receive anything, then it is recommended you email our office or you give our office a call, and it's recommended that you let us know, because if you don't have an offer, then it very well could be that we're waiting on something to come in. We're still expecting certain information. So again, if you haven't received anything by now, please give our office a call, and we can find out what's going on. Just real quickly, talk about some things with some of the questions that were asked here. I do want to reiterate again, as Kier said, that students are the central point of contact again. So that's the same for our office as well. So any communication is going to go through your students. For our office, if there are requirements that are needed, students can go into their Banner self-service portal, and under the Office of Financial Aid link, they should be able to go into requirements section and be able to see anything that's missing. Our office does also send out quite often, I think every other couple of weeks, we do send out emails to students as well, generated emails, letting them know that we're missing something or that we need something. So again, it's another way. So again, as Kiera said, it is up to students' responsibility to go in there and make sure that they're checking their portals, to make sure they're checking their information, and emails as well. So if something comes from the Office of Financial Aid, and I will say the same thing for anybody else on this webinar as well, it's very important. So please tell your student not to pass by it. So let's talk real quickly about FAFSA. So many of you this year, FAFSA has been the bane of the existence of every financial aid person in the country. It has not been great, as you probably all have been aware. And some of your family, and most of your families, domestic families, that is, probably had a hard time with it. As a matter of fact, there was a question here that I had in here talking about there was a problem with the FAFSA. Question basically, they're getting error messages about the FAFSA. That's been going on. This has been, again, we're a few months behind because of the FAFSA issues. If you're getting error messages on the FAFSA, the only thing I would say to you is right now is you're probably gonna have to give the Department of Education a call. There should be a number. There should be a number you can call them, FAFSA number. You can give them a call, and then thank you very much, Mikhail. Put that on there, and you can again find out what's going on. They can help you with these error messages. Again, unfortunately, our hands are tied with a lot of this as well. The FAFSA, the Department of Ed is still working out kinks, so unfortunately, you're still going to get these things. Also, what I would say to you too is if you are having those problems too, you can also give us a call as well, because the second part of the question was please advise on the deadline for how to apply for aid. So really right now, because of the FAFSA issues, and our office is well aware of these problems, you can of course, again, contact our office. I don't want to say there's no deadline, but I would say contact us ASAP if you are having problems as well, so we can kind of like guide you, and so we can know what's going on with you as well, so we can make note of that. The FAFSA is something that it does have to be completed each year. So FAFSA does have to be done each year. So typically it comes out on October 1st. Typically this year it did not, but usually it should. And right now we're being told from the Department of Ed that they're on plan, or they're on, they're ready to get it out for October 1st. So hopefully it'll be out. We recommend that you get it done when the FAFSA comes out and you're told that it comes out. And I think the Department of Ed sends you something, but again, we recommend you get it done right away. Don't wait. Okay. So, that's a big thing here. Now, usually the deadline for our office for everybody, for current students going forward is February 1st to have everything into our office by February 1st. But again, the FAFSA was done by October 1st. We ask you to get it done. Just get that out of the way. Obviously there are some things going up the FAFSA this year that are different. So from some of our current families joining us today, you had to deal with different things now. For instance, your student has to give you permission in order to fill out the FAFSA. So before, where you can just go in as a parent with your FSA number and your ID, now the student has to give you permission to do that. Many of you probably saw that as well. Also, there's certain lot of questions have gone from 150 down to like 30. So many of the families that we dealt with that completed the FAFSA this year, and it went smoothly for them, they said the process took about 10 to 15 minutes compared to the usually be 45 minutes to an hour sometimes. So apparently it's whatever they're doing is working. Again, just have to work out the kinks on that. After our office, after we review the FAFSA, and again, I'm talking about domestic students right now. After we review the FAFSA, our office then may determine whether or not we might need more information. So if there's more information that we might need from you. So for instance, the FAFSA automatically is going to, from now on, it actually makes you transfer your IRS information to the FAFSA. That's something you have to do now. It was optional before, not so much anymore. So now, the IRS information will come over to the FAFSA. If there are certain questions on the FAFSA that you send over from the IRS that we need to know about, then our office will then probably contact you probably for actual copies of your taxes. So for this year, we're always a year behind, 2 years behind. So this year, for instance, for the class coming in, we were looking at 2022 classes. So for everybody, if you might remember, we asked you for your 2022 taxes. So again, so keep watch of that each year. If we need more information after we reviewed the FAFSAs, we might reach back out to you and ask you for more information. You no longer, for our current students, good news for everybody. Domestic students, You no longer have to worry about doing the CSS profile. I know everybody's happy about that. So you don't have to worry about doing that one anymore, okay? The CSS just the FAFSA, like I said, and if we need more information, we'll ask you for it later. Normally, we ask what we'll do is in December, near the end of December, before the university goes on its winter break, we send out an email to all students, letting them know that, hey, it's time to get your information into our office, and you're going to have until February 1st to get all your information into our office. So that we do that, so that way students, when they go home, they can be with their families and review the information that they need. So again, usually about December 1st or somewhere between December 20th and near the end of December, an email will go out to all families, let them know what more information that we need. And you will no longer have to upload your information into the IDOC system through the College Board. You will actually upload your information directly to the Banner self-service portal. And the email that we send you will have all that information on there and tell you exactly what you need to do. There are a couple of situations that students may need to contact our office. For instance, if you're returning from a leave of absence and you haven't received an offer yet, you should contact our office and let us know. If you're applying for financial aid for the very first time, and a lot of times we see that when a family now has another child going to, also attending an undergraduate degree program, and now they might qualify for aid. So if that's happening to you, you might want to give our office a call, let us know. If you're only going to be applying for aid for spring only, then again, you might want to give our office a call as well. And then again, as I mentioned, if you didn't receive your offer yet, give our office a call. There might be something going on with that. For international students, if there's any on here, I know Mikhail said they did one earlier, but if you are, basically, again, you do not do the FAFSA, and you will have to do the profile. However, you do have to do the profile. And for international students, again, same thing. We'll send you an email around December. So same situation. We'll let you know what you have to do. You'll let us know as well as far as the information we're going to ask you for. And if we do ask for further information, a lot of times in certain countries do not file taxes. So some of you might remember that maybe your country did not require taxes. We asked you for an employer wage statement. So we might go back out asking you for employer wage statements. One of the reasons for that is because, again, you don't do the FAFSA. So some of the information coming through, we might have to actually get actual copies. So that might be something, again, that might be something we might ask for. And again, to reiterate, December 20th, an email would go out to families, let them know what we're going to need for the next year. And then February 1st is the deadline. And then real quick, I know somebody asked about loans. Yes, students can borrow, domestic students can borrow up to $5,500 first year in their federal student loans, $6,500 second year, $7,500 in junior and senior years. For students, for student loans, that's the maximum they can borrow. So pretty much everything else falls on the parent. So you have parent plus loans, federal loan, and you also have the private loans as well. And I think I'm going to leave it, hand it over right now. Forgive me. I'm going to hand it. You told me to. I'm going to hand everything over to Erica right now, and then we'll answer other questions later.
Hi, everyone. So as you can see on the screen, I'm Erica Laurent, Assistant Director of Student Health Insurance Plan Operations. You can go to the next slide. And so I just want to start out with, because this does confuse people quite a bit. Our insurance carrier is United Healthcare Student Resources for the medical plan. And we have an insurance broker, and they are Haler, Fryer, and Kuhn. So you can receive emails from Haler and from Brown. Haler is the one that is sending out all of the portal is open now emails to your students. And I'll reiterate, as my colleagues did, all communications that our office sends out does go directly to the student. Next slide, please. All right, so the enrollment and waiver portal, this is where you can waive the fee or you can enroll into the medical plan. So the action email started to be sent on June 12th to your student Brown email. And those emails will go out every week until the end of July, until the student takes action. If the student hasn't taken action by the end of July, then those emails will increase to 2 to 3 times a week until they take action. And the last week of August, they will get that email every day until September 1st, which is the deadline. So in that email, it provides link to our insurance broker's portal, and you can see on the bottom, that's what the portal will look like when you click on the link. And that's where you can enroll or waive in Brown's health insurance plan and also into the voluntary dental and vision plans. And all of the charges are charged to your Bursar account upon enrollment. So the student health insurance plan, it's a platinum PPO plan, and it offers nationwide and out of the country benefits. It is the only plan that we offer with an annual premium of $4,780. Your account is only charged one time, and it's only on your fall bill. It's not charged fall and spring. That's the whole annual premium. And the effective dates are from August 15th, 2024 to August 14th, 2025. And the name of the medical plan is the United Healthcare Student Resources Plan, and the dental and vision carrier is Delta Dental. And the voluntary plans do have the same effective dates. In the Take Action email, which is probably the most important part of my job for your students to take action, you'll find the link titled Plan, Benefits, and Documents. And on that page, if you scroll down, you'll be able to see all of the summary of benefits for the medical, vision, and dental plan. And then there are other resources there, but there also is the provider finder tool so that you can check to see if your current home providers are in network for the student health insurance plan. So if you have an HMO plan or a plan that only provides emergency benefits while your student is Rhode Island and your waiver is rejected, you can schedule a meeting with me to explore if your plan has an away from home program, which some HMOs do, not all do. And normally they're at no additional cost to you, or you can purchase a plan on the health insurance marketplace, and I can guide you through that process when you make an appointment with me. I mentioned that you can purchase a plan on the marketplace because if you have an area restrictive HMO, then, and if you were to purchase a plan on the marketplace that say has a high deductible of $5,000, the student plan, the marketplace plan would be primary, and then your secondary insurance would pick up the emergency room bills. If the student required more care after the emergency room, then only the marketplace plan would be in effect, and you would be responsible for that deductible. But we can get into all of those details once you make an appointment with me, and you'll see at the end of my presentation how you can do that. So you see the picture of the portal, and a lot of people get confused with that. It says Haler, Fryer, and Kuhn, but I've explained that already. But most importantly, it's the banner ID that is used in this portal. So your student has a Brown ID and a banner ID that begins with B. All of our systems at the student health insurance operations go through the banner ID. All right, next slide, please. So what does the plan include? Like I said, it is a platinum plan, so it covers everything that is medically necessary. So you have your prescription coverage, labs, primary care, emergency care, mental health services, inpatient, outpatient, any type of required immunizations. And for students that are under the age of 19, until the last day of the month they turn 19, they have full dental and vision benefits, which if you do have a student that is under 19 and you plan on enrolling into the SHIP plan, I highly encourage you to take advantage of it, especially if they have not had their wisdom teeth out, because that can get very expensive. And the voluntary dental plan does cover it, but your out-of-pocket costs will be much higher with the voluntary plan. All right, next slide, please. And so here's one of the summaries of benefits for the medical plan. You can see that it has a $300 deductible. In network, there is no co-insurance. Out of pocket maximum is $8,100. Your preventive care is covered 100% in network, and out of network, it's only covered 70% of the allowed amount. The office visit copay is $15. A day surgery is $100 copay. And then I will jump down to the ER room copay, which is $100 copay, and the urgent care is $15. If the student goes to an emergency room that is not one of the hospitals in Providence, then any type of lab or radiology that they have done will be subject to that $300 deductible. So the plan does not require any type of referral or prior authorization. So the student can use it at home or while they're outside the country. There is case management available. And then I just want to reiterate that the plan does include full dental and vision benefits for the students that are under the age of 19. Next slide, please. Okay, so SHIP, the scholarship and my role. So if your student receives financial aid and has a denied waiver, then they automatically qualify for the SHIP scholarship. They do not need to take any further action once they've gone through the waiver process and received the rejected waiver. Our office will notify Student Financial Services to apply the scholarship. If your student is on SHIP, and this is very important, if they receive a bill over $300, please have them reach out to me and I will research to ensure the bill's validity. Because as you can see in network, there's only a $300 deductible. So even if they went to the ER room and 2 doctors came into the office, the highest their bill should be would be like $330. So that's why I just put that disclaimer out there. That's very important, that they don't just randomly pay the bill without making sure that that's what they owe. So if your student does not have SHIP, but private insurance and receives a medical bill they don't understand or want to confirm they're paying the correct amount, then by all means, please have them reach out to me, or you can reach out to me as well. If your student loses their private insurance, you or the student can reach out to me at any time and we can have you enrolled into the SHIP plan, or I can guide you through the process of purchasing a plan on the marketplace. If on your Bursar account, you see a health services x-ray charge on your student's Bursar account, then that means that they have gone to the Health and Wellness Center and an x-ray was done. And if the student did not pay at the time of service, then it's charged to the student's Bursar account. If you do get that bill or your student informs you of it, either you or your student can reach out to me and I can guide you through the process of getting reimbursed from your insurance company. So if your student decides to go on a leave of absence, most likely they won't, but I always like to mention this, depending on where they are in the semester when they request their leave, since it's an annual plan and it's normally already paid for in July or August, then the student can just continue to use the health insurance since it's paid for. If the student is not on the plan, but a private plan and needs to enroll in the school plan, if eligible, they can. And there's a resource available for assistance for 0 personal contribution students on a leave of absence with helping them pay the premium. I just also like to let you know that I schedule educational meetings to teach the students how health insurance works or how they can best take advantage of it. And I schedule meetings on the weekends and evenings in addition to normal business hours, whichever is convenient for the student or for yourself. By educating the students, I explain their benefits and what their out-of-pocket costs will be or should have been. And it's always very helpful if they see me before their doctor's appointments, so I can help them with the out-of-pocket cost. And then another thing that I do is I can research and strategize on how to get services covered, especially with the the SHIP plan. So there are a few exclusions with the SHIP plan, but if the correct diagnosis is presented on the claim, then a lot of times we can get the procedure, surgery, or whatever service they're looking for covered. Next slide, please. And this is my contact information. So when you email studenthealthinsuranceplan@brown.edu, I'm the person that you're emailing. There are 2 other people that monitor the email just in case if I'm not available. And you can use that QR code that will go to my appointment setter calendar. And you can schedule a meeting with me if you want more details about anything that I've mentioned. I would like to mention tomorrow, we are having a webinar that will go through every screen on the enrollment portal and every screen on the waiver portal. So it is scheduled for an hour, but what I do is, once I'm on the screen, I explain everything, then we give everybody about 5 minutes, depending on the screen, for everybody to complete it, so you can actually complete the enrollment and waiver process while you're in that webinar, if you'd like. And Mikhail will put in the chat how to access that webinar. And if you'd like to go, if you have a question for our insurance broker, you can reach them at brownstudent@haler.com. And that concludes my presentation, and now I will hand it over to Heather.
So you can switch the slides, please. So this is the Health Services web page. And under health requirements, this drop down comes down and you can click on whichever your student is, and it will open up and let you know of all the required full health forms that are needed to start here at Brown. And that in the upper right-hand corner is the patient portal. They will need to have a login, and that's where all their immunization and health forms will be uploaded to. And there are also forms in there that they can manually fill out online. Next slide, please. So the health requirement deadline is July 1st for immunization and health requirements. There isn't a penalty, but for athletes, they cannot participate in sports until all their paperwork is in. I say there's no penalty, but come November and we haven't had any kind of paperwork, then action is taken by the Office of Student Conduct. We do not know what that is, but most of the time everyone has their information in by that point. We don't send information out that the student is compliant with all their paperwork, but as my colleagues mentioned, the student can go to their patient portal and the portal will let them know if they're compliant or what it is exactly they're missing. And if there's questions or concerns, they can email nursing or give us a call at Health Services. Next slide, please. Also, under that drop down I showed you, there's a checklist there. So this is the checklist, and this lets the students know of everything that does need to be turned in by July 1st to be in accordance with the state of Rhode Island and Brown's University's immunization compliance. Next slide, please. So all students are required to submit an immunization record of the required vaccines, and there are recommended vaccines on that form as well. Every student is required to do a TB screening form, a health history form, a Brown consent to share health information, which that form is between different departments in health services, not health information to be shared with parents. We don't have a blanket form for that. It's case by case basis, and the student would have to grant permission for the providers to speak to the parents. And then if under 18, there is a medical care and treatment form. And as Erica mentioned, the SHIP insurance covers all required immunizations. But if you're an international student and you have your private insurance, and your vaccines are not covered, Brown is in a program with the state of Rhode Island where we will get you your vaccine at no cost for vaccine compliance. And to come to health services, there is no charge unless a prescription is ordered, or like Erica had mentioned, if there's an X-ray. And we try to take care of all the students at health services so they don't have to go to the emergency room, but unfortunately, sometimes that does have to happen. And that's it for me. If you have, thank you.
All right, great. Thank you, everybody. We have time for a few questions. First, I wanted to note that we got a lot of questions about information going to parents versus students, and as a lot of the speakers today mentioned, once your student is enrolled and is starting their voyage at Brown, the communication really does shift to the student as the central focus for information. And one of the reasons is just because we're trying to prepare them for a lifetime of being able to manage their own needs and forms and all these things. Obviously, we need parents and families to be a guide for this, but we do try and, start that process of students being accountable and responsible for managing their journey here at Brown. In a second, I will ask the offices a little bit more about what's shared with parents, what's shared with students. But I also want to note that FERPA is a US law that does guide some of these policies and actually all of them in terms of what we can share with parents. When your student is, going through elementary up through high school, that law doesn't apply. But once they come to a college in the United States, FERPA does apply, and it means that there's a lot of records that we just legally cannot share with parents. So that's what you're hearing a lot of today. But we can get into a little bit more about how you can partner with your student to get the information you need, because obviously we do understand that you are very involved and obviously want to support them as much as possible. So I would say, let's go around. Let me start with Kirsten and just talk about what's going to students, and are there systems that parents actually can get access to through their student?
Sure. So from our office, we send out communications. We send email notifications when there's a new billing statement. And anytime there is activity on the student account, we'll send out an email once a week. We also send out emails for students to complete certain requirements, whether it be promissory note or sign up for e-refund. There are a variety of things that students need to do. All of that is sent to the student. We also send notifications about past due balances, impacts on financial holds, anything like that. That all goes to the student. For folks that are signed up by the student as an authorized user on payment.brown, they will also receive many of those email notifications. They'll receive information about billing statements, account activity, past due balances, impacts for financial holds. What families will not receive is email communication where only the student can take certain action. So setting up their e-refund account, that's something only a student can do. And even if you are set up as an auth user or your student, you would not receive that email communication from our team. But the majority of information is shared out with authorized users. One quick thing also that's important to note, if you call in and want to talk to our team and have questions about your student account, our team will validate that you are already set up as an auth user. So that is an important step. I would encourage your students to do that as soon as possible.
Great, thank you. Matt, how about from the financial aid side?
Yeah, we're a little bit more, so we do not have an authorized user type of thing. So basically all communications get sent to the student. And as I had mentioned earlier, what those times that we send communications out to students, and really at this point in time right now, again, if your student's receiving communications, we're missing information. That's really the communication that they're getting right now. Now, if you call our office, the caveat to that, however, is that if you call our office as a parent, we will talk to you. There are certain things, as Keir said, that we can't give information, as Mikhail said too, like, we don't give information about billing and things like that. We don't give where the student lives. Those questions have been asked to us before. Where are they at? Where can you go find them? No, none of that stuff we do, okay? And so really, we're going to talk to you really about your financial information. A lot of families will call and say, hey, we have as a matter of fact, the question was asked, hey, we have a change in circumstance. What can we do? Give our office a call and we'll talk to you about your information. If you're a divorced, separated family, we keep both families, parents separate information separate. So neither sees either one, and we don't share that information with them either. We also don't share your financial information with your student either. So if there are certain things that you don't want them to know about, we do get appeals sometimes where there might be something happening and you don't want the student, you don't want the student to worry, then you let us know, hey, I don't want them to know that I'm appealing. Can you please only communicate with me? Because what's going to happen is once you appeal, if you don't say that, then we're going to send a final appeal notice to the student saying your appeal's been processed, and they're going to want to know what that's all about. So again, you got to let us know that. So again, as I said, pretty much the communication right now is if we're missing anything right now.
And Erica and Heather? Erica, you want to start and then we'll go to Heather?
So my office is not as restrictive. I see that there's a question if you can complete the waiver enrollment action for your student. Yes, you can. If they forward that email to you, then by all means, please do take action, whichever one is appropriate. If your child is vacationing and you can't get in touch with them, they can't forward you the email, then you can always reach out to me at studenthealthinsuranceplan@brown.edu and I can forward you the link and brief instructions on how to enroll or waive. And outside of that, I don't really discuss anything clinical. So if you reach out to me in regards to your child that they have a bill or whatnot, then I'm pretty much at liberty to discuss it with you if you have the bill in hand. And I'm always more than happy to do so. I don't know if you want me to answer any other questions.
Yeah, I think we'll finish up
Heather.
with Heather on this question, and then I've got a couple of quick ones before we have to close.
Yeah, like Matt said, we communicate directly to the student through our patient portal, through what we call secure messaging, which is like now just about compliance if they're missing anything, or we send mass messages out to, if we're having a flu clinic or things like that, but everything goes directly to the student.
Great,
God
thank
forbid something were not, well with the student, we would get the permission from the student to call a parent to tell them something at that given time.
Of course, thank you. I do have some quick ones I want to go through and try and get to as many as we can. So I'm just gonna rapid fire this. So let's see, Erica, international students, do they have, let's see, can they waive I'm sorry, I'm mixing up two questions. Can students waive the dental and vision on the health insurance plan, but take the general insurance?
Those are voluntary, so there's nothing to waive. It's up to you whether you want to enroll or not. It's not mandatory, it's voluntary. The medical plan is mandatory. That's why there's a waiver process for that one.
Okay, and I'll stick with you. Is it covered over the summer?
Yes, it goes until next year, August 14, 2025, and you have nationwide coverage and out of the country benefits as well.
Okay, and then I'm not sure if this is Erica or Heather, but can 529 accounts cover health charges?
I think that's Kirsten.
Oh, sorry, Kirsten.
That's okay. We do receive 529 payments frequently for student account charges. So anything that is charged to the student account, we post that 529 payment. It is applied to any expense that is open. If you have questions more specific than that, I would recommend you reach out to your 529 provider and just verify with them directly.
Great, thank you. Another one for you. Is there a cost to enroll in the payment plan?
$75 enrollment fee, and again, that is per semester.
Okay, and another one, how does tuition insurance work?
Okay, tuition insurance, we partner with GradGuard, and families, it's optional. So families can choose to sign up for tuition insurance to cover In the event that the student is not able to attend and does not receive a credit. Sorry, let me step back for a minute. When a student withdraws from Brown, we have a tuition leave refund policy that is prorated based on the timing of when that leave takes place. Families can choose, if they would like, to purchase tuition insurance at the beginning of the semester, which helps to offset any financial impact that might happen from that leave. And families would sign up directly with GradGuard and communicate with them directly in the event that they signed up and needed to take advantage of those plan benefits.
Okay, thank you. Here's the international question that I had. This is for you, Kier. Is it mandatory for them to make their payments via Flywire?
It is not mandatory to make a payment via Flywire if you are an international student. There's a few, I'll try to be quick. For international students, Flywire is our preferred payment method because of the tracking that I mentioned. And also, if you have a credit balance refund that is due back to you, we can oftentimes issue that refund back through Flywire, which avoids any difficulty with receiving a US check in your home country. It's not required, and certainly if you have access to a US checking or savings account, you can make your payment by ACH through payment.brown.edu.
Great, thank you. Okay, Matt, a few for you. So somebody had a question that the fall semester bill looks higher than the spring. Can you speak to that?
That's kind of odd. I don't know why it would. You might have to call our office and talk to us about that. I mean, financial aid, we don't change it mid-year unless something, I can't even imagine what happened. Unless there's some other bill on there, but give our office a call because there might be something wrong and we could take a look at it on financial aid. Yeah.
Can I add to that real quick?
Yeah,
It could also be the health insurance,
Oh, yes, thank you.
which is posted only on the fall semester for the full academic year.
okay, all right. It takes a village, right? We're okay, so another one for you. Say parents, you may have covered this already, but is it still possible to talk to your office about financial aid, or are the packages set in stone at this point in time?
No, you can still call our office. If, again, as I mentioned earlier, if you haven't received an offer or something's happening, or say if you didn't even apply, you can give our office a call if something has changed, and we'll take a look at it. So it is not too late to do that. No, it is not.
Okay, thank you.
Can I say two things real quick?
Yeah, sure.
I'm sorry, real quick. So I want to real quickly talk about the SHIP real fast. So just so you know that, as it was mentioned earlier, that you have to receive financial aid in order to qualify for the health insurance scholarship. But that means that you have to receive university scholarship. If you don't receive university scholarship, you do not qualify for the health insurance scholarship. That's number one. Number two is any of the dental or vision that was mentioned, the voluntary one, we don't cover that with financial aid. So those would not be covered with that at all. So again, anything voluntary, it would not be covered by any financial aid or anything like that. Thanks, Mikhail. Sorry. Go ahead.
Oh, yeah, and another one for you. How and where does a student apply for a federal student loan?
Oh, yes. So please, if your student wants to apply for a federal loan, give our office a call or email our office, or you can go into your Banner self-service portal under your financial aid tab and you can request federal student loans from there. And then that's how easy as that. But if you have any problems with that, give our office, email our office and we'll help you out.
Okay, and another one about Parent Plus loans. When would parents expect to hear about a Parent Plus loan?
That's me.
Oh, sorry.
Yep. So we have just recently started our processing of Parent Plus loans for the 24-25 academic year. Families do receive an automatic credit decision when they complete the application. So as long as your loan was approved, then you know that you've got that coming. Make sure that you complete the master promissory note for the Parent Plus as well. And our office, once we receive that information from the Department of Ed, we will send out a notification letting you know of the approval. Typically at this point in the year, it's our peak time. So I would say maybe allow a week to 10 days, but if you have questions, please definitely contact our team at sfs@brown.edu.
Right, and Erica, if a family is opting out of the health insurance, how do they let you know?
They waive.
The waiver process.
Yeah, they waive. I just want to mention something real quick that
Yeah.
all students can come to the Health and Wellness Center. That's covered by their health services fee. They don't have to have the school insurance in order to see a provider at the Health and Wellness Center. They can actually come to the Health and Wellness Center every day and see a provider, and they would never be charged. And then one thing as a parent that I love to mention, that if the child is too sick, they will send up EMS to check in on them in their dorm.
Right. And
And
we have
we-
our own EMS here at Brown, staffed
Yes, we have
by,
our own EMS.
And we do telehealth appointments as well, and we have a 24-hour nursing advice line when we're not open.
right. So just to reiterate that, you do not have to have the health insurance to use Brown Health Services. That's covered by the student fee.
Every student pays the health services fee.
And
Great.
unless like a provider were to order an antibiotic, then that goes through their insurance, or blood work, that goes through their insurance. But the actual visit itself, nursing visits, that is all paid for, free. And all the required vaccines are covered under this SHIP. And like I said as well, if it's not covered, we do have a program to help those students.
Okay, we only have a few seconds left, so I just wanted to quickly make a plug for tomorrow's webinar at noon Eastern time on the SHIP plan. We're really going to get into the weeds, the details with this. We're going to pull up the portal and go walk you through it. So if you have any questions at all about health insurance, please tune into that tomorrow. Or if you have questions that we haven't answered today, please email me at family@brown.edu. Erica, just one more quick question for you. Is there anything that they should bring with them tomorrow to the webinar? Oh, you're
No,
late to
well,
go
they'll
now.
have to have, they want to waive, then they should have their medical ID card. And I want to tell you that we will start with the enrollment process. So you'll need your child's banner ID to enroll. So if you can't make it there right at 12 o'clock, you do have a little bit of leeway there if your intention is to waive.
Yes, so please ask your student for their banner ID before you tune in. It's good to know that anyway.
Yeah.
All right, I wish I had more time to ask you more questions, but I do thank all of you, Kier, Matt, Erica, and Heather. Thank you so much for joining us. Thank you to our captioner and to our media services folks, and to all the families and parents out there. Thank you so much for joining us, and have a great day wherever you are in the world.